While the City of New Orleans Mobile Crisis Intervention Unit was formed to help those experiencing a mental health crisis, but according to the health department, they will not go out on any calls that involve guns or threat to violence. As Eleanor Tabone explains, some experts say that needs to change.
The MCIU is a team of specially trained mental health professionals who will respond to calls from individuals, families, or community members who are experiencing a mental health crisis.
Since June 1st, the Mobile Crisis Intervention Unit has responded to 718 calls.
We know that this is not a service that's going to be able to take 100% of mental health calls.
While they can't take all the calls, Travis Kerr with the city's health department says NOPD can call MCIU for help and vice versa.
Mental health crises can pose some volatile environments.
Which is why we wanted to know why an MCIU unit wasn't present as police responded to calls of a disturbed man in the Pines Village residence on September 14th. A family member said the man was acting erratically and threatening family members. When police arrived to the Francis Drive home, the man barricaded himself inside, so they initiated a SWAT roll. A family member says they noticed a decline in the man's mental health in the lead up to the SWAT roll.
Providing the experts, the behavioral health experts, again, on the ground when we hear the need of our residents when they make that call.
When a call comes into 911, the staff here at OPCD have to determine if the person is exhibiting violent behaviour, if there's a threat of violence, if firearms are involved, or if the person themselves is in imminent danger. If any of those are present, the call is then triaged to NOPD. In the Pines Village case, police believe the man who barricaded himself inside might have had a weapon.
The MCIU do not go on calls involving weapons, in particular guns and knives, which is a problem because a person's hands can also be their weapon.
Janet Hayes with Healing Minds NOLA says police and mental health experts need to work together far more frequently so they can learn how to approach anyone facing a mental health crisis.
We don't want to come at them with, sirens blaring and things that are going to cause them to escalate.
It's de-escalation that can also be life-saving. NOPD says the man from Thursday's SWAT roll was taken into custody and to hospital for medical evaluation. Eleanor Tabone, Eyewitness News.
And according to the National Alliance on Mental Illness, about 2 million people with mental health problems are booked into jail every year. The city says MCIU was not dispatched to Francis Drive that day.